And the coronavirus has changed a lot of things, but maybe no profession has changed more than what doctors and nurses are doing. And we have a doctor that's dealing with all these changes joining us live this morning. Dr. Ernst von Schwarz is a cardiologist and researcher. Thanks for joining us this morning. Many of us haven't been to a doctor or into a hospital during this pandemic. How have things changed?
Oh, good morning, Joe. You're absolutely right. Actually, the practice of medicine will change forever. There's no doubt about it. And that starts with a doctor-patient relationship, which is changing because a lot of patients are scared to come to hospitals or even to clinics. So we use a lot of telemedicine. Telemedicine itself is the medium of the future in medicine. In addition, I'm teaching medical doctors all over the world, usually in person, of course, but right now via telemedia. And what we teach them mainly is about telemedicine, in fact, and the new technologies which are available very soon for this medium, basically to monitor patients from their homes rather than having them coming in.
Workload at hospitals has really slowed down for things that are not coronavirus related. And you're a cardiologist. You sent us some video of you actually in the surgery room doing work on a patient. Have you seen less people coming in due to concerns of coronavirus?
Well, in fact, yes. All the ERs, or most of the ERs, especially in California, have seen a reduction of 40 to 7% of non-coronavirus caused ER visits. So we see less patients with strokes and heart attacks coming in. And in part, this is caused because patients are scared to come and they might delay care, which might be a problem if they stay at home. But there's other factors, keep in mind, which cause or might cause a reduction of acute heart attacks. There's less traffic, there's less road rage, there's less court appearance, there's no divorces right now, courts are not in session. All those factors, keep in mind, can cause underlying conditions like coronary artery disease to lead to heart attacks, and we don't have this kind of acute stress right now.
And we know that coronavirus is obviously very contagious, but there are 5 things that COVID-19 infection can affect the health and the body. Can you kind of explain what it is for people that maybe, we know it's a respiratory virus, but what does it actually do?
Well, the first is the lungs, of course. As we all know, the lungs are affected by the coronavirus. It causes an inflammation, meaning thickening of the system in the lungs, which then impairs or worsens the gas exchange, meaning less oxygen for the whole body. The second organ system, which we don't talk so much about, is actually the heart. And the heart can be affected at least in 2 different ways. In patients with underlying heart disease, such as blockages of the arteries, that lack of oxygen caused by the lung basically can worsen the heart condition, cause a lot of damage. But in addition to that, there is a condition which we call virus-induced myocarditis, which is an inflammation of the heart muscle. And that, in fact, can affect young and completely healthy people. And many of the nurses and doctors who died in Italy or China didn't die of respiratory failure, but they died of heart failure secondary to the myocarditis. So the virus actually can bite the heart and leave a scar, or it can eat it alive.
Well, Dr. Schwarz, I hate to cut you off. We are out of time, unfortunately. We'll have to get you back on here to talk about it. But I thank you for coming in and talking with us this morning via Zoom, how we're all doing these interviews now. Some great information, Dr. Ernst von Schwarz, on how the medical world has really changed due to the coronavirus. Thank you, sir.